I'm here today because I support H.R. 676, Medicare for All. And it so happens that May is Mental Health Awareness Month. So I want to talk today about one of the reasons that I support Medicare for All, and that is a mental health care issue that is very close to my heart. The Centers for Disease Control describes depression as a serious medical illness with mood, cognitive, and physical symptoms. In one CDC study, only 1/3 of people with severe depression had seen a mental health professional in the last year. That means 2/3 of people with severe depression don't get help. My dad was one of those people. And in 1999, at the age of 51, he committed suicide. Of course, one of the reasons people don't get help is the stigma that continues to be associated with mental illness. And so today, I want to do my part to help end the stigma. I am one of the 15 million adults, or approximately 7% of the U.S. population, who suffers from depression. For me, depression has been a lifelong companion. And my first memories of experiencing those feelings of depression go back to elementary school. There are two things that have helped me survive my depression. The first is a very supportive network of family and friends. And the second is health insurance. I have never had to worry about whether or not I could pay to see my therapist. I have never had to worry about whether or not I could afford my medications. I'm very lucky to have the health insurance that I have. But I shouldn't be lucky to have good mental health coverage. My insurance should be the norm, not the exception. Everyone deserves the same health care that I have. Mental health care is also an important component of individual and economic social justice. Women are twice as likely to suffer from depression as men. People who live below the poverty line are twice as likely to suffer from depression as those who don't. LGBTQ youth are 4 times as likely to attempt suicide as their peers. And of course, race matters too. According to a CDC study of men ages 18 to 44 who had daily anxiety or depression, only 26.4% of Black and Hispanic men had received mental health treatment. For white men, the number was 45.4%. The main difference that the CDC found for the rate of treatment was lack of health insurance. When they factored health insurance into the study, the treatment levels were almost identical. Health insurance is a matter of social justice. Mental health coverage is also a matter of economic security for the United States. For people ages 15 to 44, depression is the leading cause of disability in the U.S. It can reduce worker productivity by 1/3 and cost the U.S. an estimated $44 billion a year in lost wages. The American Foundation for Prevention of Suicide determined that in 2014, suicide was the 10th leading cause of death in the U.S. That comes out to about 121 suicides per day. We hear about it when it's someone famous, like Chris Cornell or Robin Williams, or like me if it's someone who we knew in our lives. But we don't hear about the other 120 people who are killing themselves every day. And many of these deaths are preventable. We already have the treatment to treat these people. All we have to do is make it available to them through health insurance. It is simply not acceptable in a country as wealthy as the U.S. that we don't provide medical coverage to everyone. Getting life-saving treatment should not be a luxury that only the wealthy can afford. And we need a healthcare system that includes mental health care as necessary medical health care. The Affordable Care Act made some improvements on this, but Republicans in Congress are trying to take us backwards. People who have depression and other mental illnesses often have a hard time getting themselves to get help in the first place. Worry about a pre-existing condition affecting the rest of their lives puts one more roadblock in the path to getting help. It's not an exaggeration for me to say that if it weren't for my health insurance, I might not be here today. I might have been one of the people for whose depression was a fatal, a terminal disease. But I'm here because, like those Trump people who were shouting USA, I believe in my country, and I believe in the people of my country. And I believe that we all deserve health care. We all have a right to life, and we can do that together because we are better than what is happening right now in Washington.